Hi, my name is Suzanne Gornell. I'm a clinical trials nurse at Memorial Sloan Kettering Cancer Center. I'm here today to talk about why should you participate in a clinical trial. The definition of a clinical trial is something that tests an intervention, a potential drug, or a combination of drug or activity or procedure in people. They look for new ways to prevent, detect, or treat disease, and they are the heart of all medical advances. The goal is to determine if a new treatment works and is it safe. They also look into other aspects of care, like improving a person's quality of life with a chronic illness. Why do patients participate in clinical trials? Some participate to help others and help to move science forward. Participating helps doctors to learn more about the disease and helps researchers improve health for people in the future. Some participate with an illness in order to help others, but also to possibly receive a new treatment that would otherwise be unavailable to them. You may ask yourself, why should I try something that researchers are not sure will work? Participating in a clinical trial often gives you the option of having a therapy that has never been used before or has never been used in this combination that would otherwise be unavailable to you. You can get a medication before it's available to anyone else. So it's giving you another option. Whatever cancer you might have may have 3 standard of care options, but by trying this clinical trial, it could give you a 4th option. So you would start off with this option, and then you would still have your standard of care options. When you're on a clinical trial, you're getting additional care and attention from the clinical staff. Be sure to ask your physician the difference between being on standard of care versus on a clinical trial. When you're participating in a clinical trial, you're playing an active role in your own healthcare. You're making that choice. When participating in a clinical trial, some of the medications or tests are provided for free. This all depends on the trial or where you're participating. But a lot of these medications, when already approved, have a high copay, and having them free or at a discount can be appealing to some patients. So if your option is standard of care or a new drug, you're either getting a new drug, which would be beneficial, giving you another option, or the standard of care, which you could be getting through your insurance at a decreased cost. So it's a win-win. You also may have some access to more information and support groups and resources. Researchers are required to follow strict rules to make sure participants are safe. They are enforced by the federal government. Every trial needs to be approved by the Institutional Review Board, or the IRB. It is made up of scientists, doctors, and lay people, just like you. Before joining a clinical trial, you'll be given an informed consent to sign. This will tell you what to expect as a participant and what will be happening, or might be happening. This is not a contract. You can leave a trial at any time for any reason. Around 15 years ago, there were not many options for kidney cancer. Patients were given the option of interferon, which worked in about 10% of patients, or hospice. It is through clinical trials, like I've just been discussing, that we've been able to come up with over 10 treatments and combinations to treat renal cell carcinoma today. I hope this information has helped, and please reach out to your physician and nurses for any questions or concerns involving clinical trials. Thank you.